Welcome to the deep dive. Get ready, because one of the most, fundamental aspects of our life, healthcare, it's undergoing a truly profound transformation right now.
It really is.
This isn't just a minor adjustment, it's a shift so significant. It's really poised to redefine how many of us experience health and wellness very soon, too.
Absolutely. The landscape is changing incredibly quickly.
So today we're taking that deep dive into the global virtual healthcare market.
hmm
And when we talk about virtual healthcare, we mean, a whole spectrum of things, right?
Exactly. It's not just one thing. It's everything from, say, telehealth consultations you might have directly
Oh,
to remote monitoring devices, the kind that track your vitals at home.
right, like wearables and things.
Precisely. And then you've got AI diagnostics helping out digital therapeutics, which might be app-based treatments. It's broad.
Got it. So our mission today is really to unpack the data behind all this change, understand the scale, and crucially, highlight what these, frankly, staggering growth figures mean for you, the listener.
Yeah, connecting the dots between the numbers and real-world impact.
Exactly. So let's start with that global picture. According to Cognitive Market Research, the whole market was valued at 5,607.44 million back in 2021.
Just over 5.6 billion. Yeah.
Then fast forward just 4 years to 2025, and it's projected to hit $14,882.8 million. Nearly $15 billion.
A pretty significant jump in just a few years.
But here's where it gets really interesting. By 2033, they expect it to surge to an astonishing $104,839 million.
Over $100 billion.
That's a compound annual growth rate, the CAGR, of 27.638%. I mean, that kind of trajectory, it just suggests fundamental change, doesn't it?
Oh, absolutely. A KGR like that sustained over a decade. It's indicative of a major transformation.
Yeah.
And what's fascinating here, it's not just the sheer scale of those global numbers,
Right.
but the powerful mix of factors driving it. We're definitely seeing that post-pandemic push in digital adoption continuing.
Mm.
People are just getting more comfortable with virtual care. Plus, the rise of remote monitoring for chronic conditions is huge, and AI diagnostics are becoming, more common.
So it's really moved beyond just video calls with the doctor.
Way beyond. It's a much more comprehensive shift in how care is actually delivered and how we as patients consume it.
That's a great point about the diverse drivers. Okay, so let's dig into where this growth is most concentrated right now. North America seems to be leading the pack.
Indeed, yeah. North America's market hit 2,540.77 million in 2021.
Okay.
The forecast for 2025 is 6,645.77 million. And then that explosion you mentioned, 45,500.3 million by 2033, just under half the global total.
45 billion. Wow.
And this LIND, it isn't just happening by chance. It's heavily influenced by things like really robust venture capital investment in health tech over there.
Oh, okay.
Insurance reimbursement models are changing fast, covering more virtual services.
Lucky.
And there's strong consumer demand. People want convenience, immediate access.
And to really grasp that scale within North America, the United States is the primary engine, right? Projected growth from nearly $2 billion in 2021
$1,999.11 million.
to over $35 billion by 2033. $35 billion. I mean, just to put that in perspective, that's more than the GDP of some smaller countries.
It's a staggering figure, all throwing into how Americans are accessing doctors, specialists, managing their health digitally.
Yeah.
And while the U.S. definitely takes a lion's share, we're also seeing really significant growth in Canada. It's projected to rise from about $353 million in 2021 to over $6.7 billion by 2033.
Okay, so still very strong growth.
Absolutely. And Mexico, too, is showing considerable expansion from around $188 million to nearly $3.5 billion in that same time frame.
So it really demonstrates this isn't just a U.S. phenomenon, but continent-wide adoption.
Exactly. Across different economic landscapes driven by local needs, different regulatory environments, all sort of embracing digital health in their own way.
Okay, let's shift gears then. Let's look at the Asia-Pacific region. Its demographics and tech adoption seem to be fueling just an incredible surge.
Oh, definitely.
This market started at what, $1.2 billion in 2021?
1,228.03 million, yes.
And it's looking at an incredible 25,790.5 million by 2033. Over 25 billion.
It's a massive leap. And if we connect this to the bigger picture, the APAC region's explosive growth often comes from, what we sometimes call leapfrogging traditional infrastructure.
Leapfrogging. How so?
Well, many areas historically lacked maybe robust physical healthcare facilities, right?
Mm-hmm.
but they have incredibly high mobile phone penetration. Everyone's got a smartphone.
Right.
So this lets them leverage virtual solutions to reach huge, previously underserved populations.
Mhm.
Virtual care isn't just an option there. Sometimes it's the main way to get access.
That makes a lot of sense. And China's role here.
Dominant. Predicted to grow from about $405 million in 2021 to a truly staggering $8,678.5 million by 2033, almost $9 billion.
Wow. But it's certainly not just China driving this in APAC.
Not at all. Japan's also set for impressive growth, from $184 million up to over $3.5 billion.
Okay.
And India shows really significant momentum, too, climbing from $135 million to nearly $3.2 billion.
$3.2 billion for India, and then there are other key players, too.
Yeah, absolutely. You look at the 2033 projections, South Korea is over $2 billion, Australia, nearly $1.3 billion, Singapore, around $760 million,
Okay.
Southeast Asia as a whole, looking at $2.3 billion, and Taiwan, over $1 billion as well.
So these numbers really highlight a sort of region-wide commitment to digital health.
Yes, often integrated right into national health strategies. It's a priority.
Okay, moving across to Europe now. We see a solid, steady expansion there, but maybe with its own unique dynamics.
That's a good way to put it. The market there grows from about $1.1 billion in 2021
1,087.84 million, yeah.
to an estimated $19 billion, just over $19 billion by 2033. So solid growth.
19 billion.
Yeah.
Still very significant.
Definitely. But it's interesting how different countries are navigating things like data privacy regs,
Yeah.
GDPR, for example.
Ah, right. That must have an impact.
It can shape adoption rates differently compared to, say, the US or parts of Asia.
Mm.
It requires careful navigation for the virtual care providers,
Yeah.
but the growth is undeniable. Countries like Germany,
Yes.
they're forecasting a rise from about $225 million in 2021 to over $4.2 billion by 2033.
Over $4 billion for Germany alone.
Yeah. And France is set to grow to over $2.5 billion.
Mm-hmm.
The UK, similar, around $2.45 billion.
Okay.
Italy's looking at $1.8 billion. Russia, over $1.1 billion by 2033.
And there are other significant European markets, too.
Smaller, maybe, but still significant contributors. Spain is projected around $1.7 billion. Sweden, over $1.1 billion. Switzerland, about $818 million. All contributing to this robust European expansion.
And often bolstered by public health initiatives.
Exactly. And national digital health strategies play a big role there, too.
Okay, let's shift our focus south now to South America. An emerging market, I gather, with substantial potential.
Yes, definitely emerging. And often driven by that need to overcome, huge geographical barriers to care in some areas.
Right.
The region's set to grow from around $314 million in 2021
Yeah.
to $6.1 billion by 2033.
6 billion. So thinking about those regions where healthcare access can be a real challenge, maybe due to distance or infrastructure, what does this mean there?
Well, Brazil is definitely leading the charge in South America. It's projected to rise from about $116 million to a massive $2.2 billion by 2033.
2.2 billion for Brazil.
Yeah. And Argentina's projected over $1 billion, Colombia nearly $1 billion too by that time. It really showcases how virtual care can potentially bridge some of those significant access gaps.
Okay. And the Middle East. Another region showing accelerated adoption.
Yes, accelerating adoption is the right term, growing from about $263 million in 2021
Right.
to just over $5 billion by 2033. $5 billion.
What's driving it there?
A lot of nations in the Middle East are prioritizing healthcare diversification and digital transformation. It's often part of broader national visions,
Like Vision 2030 type initiatives.
Exactly. So that leads to significant government and private sector investment in these virtual health solutions. Saudi Arabia, for instance, forecast to jump from about $75 million to over $1.4 billion.
Huge jump.
Yeah. And Turkey and the UAE are both expected to exceed $800 million. We also see significant growth projected for Egypt, around $657 million, and Qatar at nearly $500 million by 2033.
Okay, and finally, let's touch on Africa's transformative potential. Starts from a smaller base, right?
It does, around $174 million in 2021.
$173.831 million.
Right. But it's expected to surge to $3.3 billion by 2033.
Over $3 billion, that's still a truly significant climb.
It really is. And it promises to hopefully democratize access to care in many areas.
So this really raises an important question, doesn't it? How will these trends fundamentally reshape access and maybe even health outcomes in places where healthcare has historically been, challenging?
That's the core question. We see Nigeria projected to grow from just $27 million to over $500 million, $536 million.
Wow.
And South Africa from about $58 million to over $1.2 billion by 2033.
Over $1 billion for South Africa.
Yeah. These figures, they really underscore the vast, largely untapped potential for virtual healthcare to bridge gaps, connect remote communities with specialists, improve health outcomes, often in really innovative, mobile-first ways on the continent.
So wrapping this all up, what we've really seen today is this clear picture of just monumental, sustained growth in virtual healthcare. And it's everywhere, every single continent.
It's not a niche trend.
Not at all. Not a temporary fix from the pandemic either. It seems to be a truly global phenomenon, driven by tech, changing patient expectations, policy shifts. It's fundamentally reshaping healthcare as we know it.
Absolutely. And it's important to remember, these numbers aren't just abstract statistics floating around.
No.
They represent a fundamental shift in how you, listening right now, might experience healthcare in the coming years. Seriously. Think about it.
Yeah.
Whether it's your routine checkup, seeing a specialist, maybe managing a chronic condition, or even accessing mental health support, that digital doorway to health is just opening wider and wider.
Offering convenience and reach that maybe wasn't possible before.
An unprecedented convenience and reach, yeah.
So I guess the final thought to leave everyone with is this. Given this exponential growth, this broad adoption we're seeing across totally diverse global contexts, how might virtual healthcare not just change how you receive care, but how might it fundamentally reshape your actual expectations for health and wellness, for accessibility, for personalization? What are you going to expect in the next decade?
That's the big question going forward. What becomes the new normal? Welcome to the Deep Dive. Today, we're looking at something huge, how healthcare is changing, specifically the virtual healthcare market. This isn't some futuristic idea anymore, is it? It's really reshaping how we all get care right now, globally. So our mission today, to give you a clear picture of this big shift, we're going to unpack the key things pushing it forward, the major hurdles, and maybe most excitingly, the trends shaping what's next.
And it's important to mention all the insights we're discussing. They come straight from detailed analysis by cognitive market research, so it's solid information.
Exactly. So as this virtual wave grows, what could it mean for you, for how you access healthcare down the line? Let's dive in. Okay, so first up, what's really putting the gas on this market growth? There seem to be some powerful forces. What's the biggest one our research highlights?
Well, the main driver really is this growing demand for remote healthcare services. It's not just one thing, you see. It's factors like the rising number of people with chronic conditions, needing regular check-ins. Plus, we have an aging population globally. And people are just much more aware now that digital options are actually out there. Patients are actively choosing virtual care for, well, lots of things. Things like non-emergency issues, follow-up appointments, mental health therapy, which is huge, and managing chronic diseases.
And I guess the COVID-19 pandemic really threw fuel on that fire, didn't it? Sort of forced the issue.
Oh, absolutely. That was a massive catalyst. The pandemic basically normalized remote interactions between patients and doctors almost overnight, changed expectations completely.
Makes total sense. But, all this demand needs the tech to back it up. What about the infrastructure piece? That seems critical.
You're absolutely right. That's the second key driver. The enhancement of digital infrastructure and, crucially, connectivity. We're talking widespread, high-speed internet, reliable 4G, and increasingly 5G networks, plus everyone having powerful mobile tech in their pocket. This makes things like real-time video calls and sophisticated health apps actually work smoothly. And it's vital for bridging those healthcare gaps,
Yeah.
especially getting care to people in rural or underserved areas. Good connectivity is key.
Right. So it's not just patients wanting it and the tech being there. Governments seem to be stepping in too, right? What's happening on the policy front?
Yes, government support is definitely the third big driver. They're acting as accelerators through various policy incentives. We see this across North America, Europe, Asia Pacific, things like telemedicine subsidies, expanding reimbursement programs so insurance actually covers virtual visits, and even relaxing some regulations to make it easier. In the U.S., for example, Medicare and Medicaid plus private insurers have broadened their coverage significantly. Basically, these policies make virtual care more accessible and more financially viable for lots more people, especially helpful for, say, elderly populations or those in rural settings. It shows policymakers see the value.
Okay, so those are some strong tailwinds pushing virtual care forward. But like any big change, there must be some pushback, some challenges. What are the main restraints cognitive market research identified?
Yeah, definitely not all smooth sailing. The first, and it's a big one, revolves around privacy and data security concerns. You see, these virtual platforms handle extremely sensitive personal health information. That makes them, unfortunately, prime targets for cyber attacks. And this leads to patient hesitancy. People are understandably worried about data breaches, identity theft, or, their private medical records getting into the wrong hands. And sometimes, maybe inadequate cybersecurity measures on some platforms or just a lack of awareness about data protection makes those fears worse.
That's fundamental, isn't it? Trust is everything in healthcare. But beyond security, it sounds like there are also issues with just how virtual care fits into the existing rules and regulations.
That's a second major restraint. The regulatory and licensing landscape is, well, it's complex and fragmented. The core issue is that the laws, the licensing rules, they vary massively, not just between countries, but often between states or regions within the same country. So imagine a doctor trying to provide care across state lines or internationally. They can face huge hurdles needing multiple licenses. It really limits how easily providers can scale up their services.
Wow, yeah, that sounds like a real tangle. And then for a lot of people, maybe the barrier isn't even the tech or the rules, but just being able to use it. What about digital literacy and access?
Exactly. That's the third key restraint. Limited digital literacy and simple technological access. This tends to hit certain groups harder, older patients perhaps, people in very remote areas, or those with lower incomes. For them, just navigating a virtual health platform, maybe needing a smartphone they don't have, or reliable internet that's not available, or even just knowing how to use the tools, it can be a real barrier. This digital divide, it definitely reduces how effective virtual care can be for everyone and slows down adoption in those key groups. Creates an equity issue, really.
Okay, so we see the drivers and the hurdles. Now, let's shift gears and look towards the future.
Yeah.
What are the really exciting trends shaping what virtual healthcare will become? The cutting edge stuff.
Right, moving to the trends. A major one is the adoption of AI-driven virtual assistants and even diagnostics. Artificial intelligence is starting to really streamline things, automating tasks like initial symptom checks, helping with triage, scheduling appointments, sending medication reminders. The benefit here is efficiency, of course, but it also potentially eases the workload on doctors and nurses, freeing them up for the more complex patient interactions.
That's fascinating. And it feels like our everyday gadgets, our phones and watches, are becoming these powerful health monitors, too.
Absolutely spot on. That leads to the second big trend,
Yeah.
the explosion of wearable devices and IoT Internet of Things-based remote monitoring. Think smartwatches, fitness trackers, but also more specialized medical-grade wearables. These devices capture real-time health data, heart rate, glucose, oxygen levels, sleep patterns, you name it, continuously. So physicians can potentially monitor this data remotely, adjust treatments, personalize care, maybe intervene earlier before something becomes a crisis. It's really changing chronic disease management and could reduce hospital visits.
Huge implications there. And finally, there's an area where virtual care seems to be making a really profound impact already, reaching people who might have struggled to get help before.
Yes, and that's the third key trend, the rapid growth in virtual mental health and behavioral therapy. Online platforms are increasingly the go-to for therapy sessions, psychiatric assessments, even just mood tracking apps. Patients often prefer the privacy, the flexibility, the convenience of doing it from home. It breaks down a lot of stigma and access barriers. And we're seeing cool innovations too, like AI that might help analyze mood patterns, really sophisticated app-based therapy programs, even VR, virtual reality being used in treatment. It's really expanding mental health care options.
So when you pull all this together,
Mm-hmm.
what's the big picture? It really feels like the virtual healthcare market is racing towards something more inclusive, smarter, and definitely more patient-focused.
I think that's right. While there are definitely significant challenges we talked about, regulation, data security, the access gaps, the momentum is undeniable. It's really being powered by that government support, the improving digital backbone, and these, quite frankly, groundbreaking innovations in AI and wearables.
It's clearly not just about convenience anymore, is it? It feels more like a fundamental rethinking of healthcare for our times. And just a reminder, all these insights we've explored today come directly from cognitive market research.
Mhm.
So as virtual healthcare keeps evolving, maybe think about how these shifts could impact not just your own access to care, but maybe even how we define what a healthy community looks like. What new possibilities or perhaps new questions does this deep dive raise for you?